Thank you, Conference. Moving on to Resolution 20, decriminalise cannabis for medical use, to be proposed. Shh. Thank you. To be proposed by Laura Brennan-Whitefield and seconded by Jennifer Dunn. Welcome, Laura, who's also a first-time speaker.
Good morning, Conference. There's a lot of people here today. That's good. My name is Laura, and I have been living with multiple sclerosis for 9 years. And the fact I am standing here, Conference, giving this speech means that I am one of the lucky ones. It has become very clear to me over these last 9 years that many people living with MS have been using cannabis to help with the symptoms of that condition. In fact, it's one of the worst kept secrets at the hospital. All of these people risk a criminal record, unlike in Australia, Chile, Canada, Finland, France, Germany, Romania, and some US states. Some allow the raw plant, others a mouse spray. In any case, we as a developed Western nation are fast becoming behind the times. We are the odd ones out. In fact, a report published on the 13th of September of this year by a cross-party group of MPs and peers was called on the government to introduce a system that grants people access to cannabis for medical reasons and to criminalise the growing of small amounts at home for the same purposes. However, the law as it stands in the UK means that cannabis is a Class B drug, and the current penalty for possession is up to 5 years in prison, an unlimited fine or both, and for supply and production up to 14 years in prison, an unlimited fine or both. Now, I don't think someone who is in pain should be criminalised for trying to ease that pain. But it is worth noting, if you have MS and the money, with an annual supply for a typical patient expected to cost around £4,250, you can obtain a private prescription for a drug called Stativex, which is licensed but not widely available on the NHS, both in England and Scotland, which contains cannabinoids. Does that sound fair to you? If you can pay, you're not breaking the law, but if you can't, you run the risk of a criminal record. Not only that, you're forced into relying on an illegal drug market where there is no guarantee of quality and consistency of supply. And can I be clear at this point, Conference? I am talking about the medical use only of cannabis. And it is that medical use which is wider than just MS. Arthritis, cancer, Crohn's disease, epilepsy, palliative care have all been shown to benefit from cannabis medications. Given that these people who are suffering pain, and I can assure you, Conference, have by the time they are willing to use cannabis, in most cases, exhausted every other option, is it not unreasonable to criminalise them? I am talking about some of the most vulnerable people in society who may have had the added misfortune of going through the DWP's inhumane assessment procedure for disability benefits. To then brand them criminals for trying to have a quality of life. I know what it is to suffer pain. And be in no doubt, Conference, if it came to it, I would not hesitate to ease that pain any way I could, because that is a natural instinct. But the problem being, if my condition was to deteriorate to that stage, I would be relying on other people to help me, my friends, my family, and most of all my partner, Stephen, who I really don't thank enough for the care that he gives me, so I'm thanking him now. I don't think carers should be criminalised either. A drug conviction has very real consequences, serious consequences for your future prospects and employment prospects. Conference, I think now is the time to show that we are the party of compassion and common sense, And it is now that we should be sending out a message to those people in pain that we hear you and we are not shying away from this issue. As Westminster has. Let's today start this journey. Let's lead with our hearts and our minds by demanding the devolution of power to allow us to address this issue. I urge conference to pass this resolution. Thank you.
Thank you very much, Laura. And Jennifer Dunn to second the resolution, to be followed by Tom McEwen, who will move the remit back. Welcome, Jennifer.
Thanks, Derek, and thanks very much, conference. This is a resolution about fairness, compassion, and common sense. In many other countries all over the world, cannabis is used as a legal form of pain relief. It has been used as a medicine for thousands of years. Many modern-day states have devised ways of allowing citizens who have a legitimate need to access cannabis and to be able to do so legally. The system we have in the UK is just another example of how people who are ill or have disabilities are treated with less compassion than they really deserve. Most people would find it very hard to know that a loved one was in pain. They would find it very hard knowing that there was a substance that was cheap and readily available that could relieve that pain that they couldn't buy, because doing so would make them a criminal. The current state of affairs criminalises compassion, and it shouldn't be allowed to go on. I don't believe that we should be in the position that we have to ask the UK for these powers. I believe that we should have them with independence and as a right. But we are where we are, and so the resolution asks the UK government to give us the chance to do something better. They might be unwilling or unable to follow the path of Australia or Canada, but Scotland should be given the power to do something better. We know that many members of Parliament, many MSPs, many delegates and many members of the public believe that we should do better in this area and that cannabis should be used for legal pain relief. Support the resolution, but don't just support the resolution. Follow the campaign. We're using the hashtag #MedicalCannabisScot. Sign the petition that we're about to get going that asks the UK government to devolve these powers. And come along to the Fringe meeting, which is at 12:30 in the Leaving Suite, to find out more. Please show compassion and support the resolution. Thank you.
Thank you, Jennifer. And to move the remit back is Tom McEwen, to be followed by Fiona Finney. And Tom's a first-time speaker, so welcome, Tom.
Thank you, Conference. I'm a healthcare professional. I'm a pharmacist who works on the NHS, and it's very difficult to remit this back because I know that patients benefit from taking this product. But the resolution itself says that this should be able to be prescribed. And there's two things going on here. There's a pharmaceutical product that the company never submitted approval to the SMC, so that product could be used. Why they didn't do that can only be assumed that they don't think the evidence that exists for the product is actually strong enough for it to be approved, or that the medicine is too expensive that it wouldn't pass the economic assessment that the SMC puts on all medicines. So as healthcare professionals, we do want our patients to have everything we can throw at them to help them, but we want to do them no harm. The systems and processes we have to make, test, approve and monitor medicines are there to ensure medicines are used safely as possible, so they can be stopped when they don't work and they can be stopped when they cause harm or problems to patients. Cannabis that people are buying on the street illegally is not a medicine, it's a herbal product. As a non-pharmaceutical product, cannabis would not meet the standards of a safe medicine with quality assurance standards that patients were getting what they think they're getting. Legitimising an unregulated product by saying it could be prescribed opens the door for the snake oil salesmen and the fraudsters to take advantage of these patients, these desperate people who want something to help them. So the resolution as it stands, it doesn't fail because I don't think it should be decriminalised and our patients shouldn't be criminalised. I completely agree with that. How it falls is that cannabis as a herbal product cannot be prescribed. It does not meet the standards necessary for doctors and prescribers to prescribe it. And the pharmaceutical product that does exist isn't worth the effort. It isn't good enough a product. It doesn't work. Thank you.
Thank you, Tom. And Fiona Finney to second the remit back. And also give Fiona a warm welcome. She's a further first-time speaker.
Conference healthcare professionals like myself are always looking for something to help people with their pain and with the spasms that you get with multiple sclerosis that causes that pain. Scotland has a world-leading process for using safe and effective medicines when we prescribe. It's called the Scottish Medicines Consortium. The world looks at what we do there. The company who make Sativex did not submit evidence to them. They did not submit evidence in the United States. They have been unable to make a real success of the product Sativex. I've been involved in prescribing Sativex, and you might be surprised to hear that Sativex can be given to patients, the appropriate patients, on the NHS, and I have been involved in them actually getting it. It's not a case that we can't give it, and it's not a case that that's criminal. It's still listed as category B, but its subsection is 4 instead of 1, the same as the rest of cannabis. You can get it on the NHS. The trouble is, the patients that I came across had great hopes for this, and it didn't work. The reason it's not taken off is we didn't get an awful lot of success with it. But that doesn't mean that a new patient can't try it in case they can get it to work. Cannabis itself is a different product altogether. The cannabis that some patients seek to smoke to take away their pain is a risky thing. There's a whole lot of side effects. You can get abdominal pain, intestinal obstruction, sweating, paranoia, dizziness, nausea, cough, auditory and visual hallucinations, memory loss, and you can get a different trip every time. We've absolutely no control over it at all. If people in pain want to use that, then yes, decriminalise it for them. It's their choice. And at that point, maybe it's worth all these side effects, but it's not actually going to be available as a prescribable product. The BBC in August 31st, 2010 said smoking cannabis from a pipe significantly reduces chronic pain in patients with damaged nerves. They also said anxiety and sleep. Conference, it wasn't proven at all. That was 23 patients in that survey. Conference, my yellow light's flashing. I can't explain this more to you. Don't make conference look silly. It can't be prescribed in this way. What we really need is one that decriminalises having the cannabis for the people who really need to use it. Separating out the oils so that we don't get the side effects hasn't been shown to work yet. They're trying to do it for children in epilepsy now in a study on about a dozen children in Japan in the hope that they can market their product in a different way, giving it a new name of Epidiolex. I'd love to speak to you more, but I'm not having myself cut off. Thank you, Con.
Thank you. Thank you, Fiona. Councillor Audrey Doig. And Audrey will move the direct negative to the resolution. Thank you, Audrey.
Councillor Audrey Doig, Linwood and Craigends branch. I have 2 reasons for being up here today and putting the direct negative to this motion. Nowadays, people are looking for quick fixes as far as pain is concerned. and they look for quick fixes as far as when the pain medication doesn't work, and they basically go to stronger painkillers. I'm afraid that this is what would happen with this particular medication. And how do I know this? The reason being is I have a cousin who died a number of years ago in Canada. He started taking cannabis because he was having pain when he was playing ice hockey, and his mates in ice hockey did the same. But unfortunately, my cousin had an addictive personality, and when the pain wasn't relieved by taking cannabis, he went on to stronger drugs. And how do I know this affected him? He had an accident early in his 30s. He was taken to the hospital. They were going to basically operate, and the consultant said, his brain is mush from all the drugs that he's taken, he's not worth saving. That affected our family drastically, but that was the truth. There is alternatives to basically pain medication, and a lot of doctors are basically prescribing that a fitness regime for getting you fit in all different ways, and we have MS patients who come to our centres to go through this regime, actually increases the fitness to all your body, and you decrease the amount of painkillers you're on. That is the way to go, people. Stop all these pain medications. Go to fitness regimes. The doctors are trying it out now, and it's working. It's working for heart patients, it's working for angina, and it's working for MS patients too. I don't want to see this go through just to have another form of medication. And my other fear is, if doctors get this ability to prescribe something similar or better, what happens when they get somebody in their surgery who pressurises them in to give them this drug? Because we all know what happens. They take the easy route, all right, okay, just have it. But they're still taking the illegal stuff too, because if you think that doesn't happen, then you're living in an unreal world, because there's plenty of methadone takers still take the illegal stuff too. It happens today. I'm not saying it'll happen right away, but it does happen in every surgery in this country. Please reject this completely, and if the MS people want to do trials and different new things like the two previous speakers do, yes, maybe go that way. But more medication, more pain medication isn't the answer. The answer is get us all fit. Thank you.
Thank you, Audrey. And Angela Thompson, you come to speak in favour of the resolution. Sorry for the short notice. And then those wishing to sum up, can you please come back to the stairs? So that'll be resolution, direct negative, and remit back. Come forward if you wish to sum up. Please welcome Angela, who's our first-time speaker at conference. Welcome, Angela.
Hi, I'm Angela Thompson from the Lark Hall branch, and I'm here to support this resolution. My husband was diagnosed with multiple sclerosis 13 years ago. He had previously used cannabis recreationally before this and had stopped so that we may be able to start our family. Within weeks of stopping, he had started displaying symptoms of MS. Since his diagnosis, he has lost the sight in one of his eyes, the hearing in one of his ears, as well as increasing mobility difficulties. It took us 2 years to get him on a treatment plan, and that treatment plan has side effects which make daily life very difficult. But there is a treatment that could help, but it is illegal. There are a wide range of conditions that medical cannabis can treat, such as multiple sclerosis, ME, fibromyalgia, sleep disorders, depression and anxiety, as well as managing the side effects of treatments such as chemotherapy and radiotherapy. It can treat more conditions than aspirin or paracetamol, but they are not illegal. What would you do in my husband's place to alleviate the terrible symptoms of his condition? It would be great if this government could explore funding scientific research into the use of medical cannabis. Thank you for your time.
Thank you, Angela. So to sum up, Tom McEwen, to sum up for the remit back. To be followed by Audrey, who'll sum up for the direct negative.
A lot of very good things have been said in this debate, and I think I want to remit this back because I think this is the start of a process for cannabis to be able to be used in patients. I don't think we can jump to the end game of it and say, prescribe it. Thank you.
Thank you. And Audrey, to sum up for the direct negatives.
I'll keep it brief. Australia back in the 1950s legalised cannabis. 20 years later, they made it illegal. Why? Because the results were not good, and that's why they illegalised it again. I know that where the MS card is being played here, but it's not just MS that it would be used for. I'm sorry, but it's true. This is not just for MS patients. This is for everybody who is a doctor to be legally prescribe this. So it's not the answer. Vote against this, please.
Delegates, can I ask you to show all speakers respect? Can I ask all speakers to show everyone else respect? And to sum up for the resolution, welcome back, Laura.
Let me be clear, Conference. I am not advocating the smoking of cannabis. What I am advocating is a progressive and reasonable, compassionate society where you can access pain relief. I believe we have the talent, the skills, and the ability in Scotland to make this work. And I would simply say to some of the speakers, if it can be done in Germany and the States and all the other countries I pointed out, it can be done here, and there can be quality control and consistency of supply. They've managed it, we can do it. I would also ask you not to remit this back. Don't file it away for things to do another day. It's too important. And as for the ability to relieve pain through exercise, where that may be appropriate for some people, for the people I'm talking about, they're bedridden, they're in wheelchairs, they're in agony, and they need relief now. Please vote for this resolution.
Thank you, Laura. Thank you. Thank you very much. Now, delegates, cards at the ready. What I'll do is I'll take a vote for the remit back and then the resolution. Those in favour of the remit back, please show. Cards down. Those against the remit back, please show. Cards down. The remit back falls. Those in favour of the resolution, please show. Cards down. Those against the resolution, please show. The resolution is passed overwhelmingly.